That is, since the hospitals need to get paid and the doctors want to get paid, if the private insurers won't provide coverage for it, then the public sector does. So Medicaid enrollment keeps going up. And what's the rationale? It's that if people can't afford their medical bills, then the government will pick it up. Now, back in the 60s, there was a term which applies here called lemon socialism. That is, the private sector gets the things that are profitable, and the government picks up the things that aren't profitable. And since healthcare is largely, at the delivery level, a nonprofit enterprise, doctors and nonprofit hospitals, the government picks up the tab more and more. And so you see, I think very few people outside of those of us who sort of cover this field really know that a quarter of the population of this state and this country is on Medicaid. That is on a government-funded healthcare program, because private sector can't cover it. I mean, let's look at it a slightly different way. What does private insurance cover? It covers the people who are working. Well, the people who are working, by definition, they're healthy. They're at work. When they're not working, when they're poor, when they're retired, when they're elderly, when they're disabled, Medicaid and Medicare pay the bill. So government pays the bill for the sick part of the population, and the private insurance, for-profit insurance, covers the people who are healthy, by and large. I mean, sometimes everybody gets sick at some point, but by and large, working people are healthy. So this is the reason why we're talking about healthcare today. So here's one illustration of underinsurance that I talked about earlier. Deductibles are going up and up and up. This is 2004 to 2017. This is the average deductible on an employer-based, employer-provided insurance policy. Back here in 13 years ago, it was $580. Now it's $1,500. Remember what the deductible, you understand what the deductible is. It's the amount you have to spend out of your pocket before insurance actually covers anything. The policies that people buy on the exchange, on the ACA marketplace, will have deductibles of $3,000 and $5,000 in some cases. So you end up paying for a premium about $3,000 to $4,000 a year, and you have a deductible of $3,000 to $5,000. You're almost at $10,000 before you have any coverage. That's not coverage. That's being totally underinsured. It's not very different from being uninsured. But this is the story of what's happening today. The insurance is getting worse and worse. It covers less and less. So the ACA was passed back in 2010, the Affordable Care Act. Did it cover everybody? No. The number of uninsured at that time was about 55 million. Remember, uninsured means for an entire year, not just episodically. Today, it's about 28 million people with no insurance nationwide. A little more than 1 million people in New York. New York actually has a very generous Medicaid program, and so our uninsurance rate is down to about 6 or 7%. But nationwide, it's about 9%. And 28 million people with no insurance.
I have a question.
Yes.
So on there it said that 5